Good evening, Namaste, Sat Sri Akal, Assalamu Alaikum. I'm Dr. Kamila Haider, and we are here again for Radio Fazan 97.1 FM Healthy Discussions by Dr. Kamila Haider, that's myself. Again on Thursday, we have got a beautiful show designed for you guys. We have a very special guest today, and we're going to talk about a very special campaign, a new campaign that has been launched by NHS England, which is called Pharmacy First. And this campaign has its criteria to aim to increase the awareness of community pharmacists who can now supply medications for seven conditions, if appropriate, without the need for a GP appointment or a prescription. So basically, what we're saying is that you don't have to go to GP or you don't have to go for repeat prescription. You can go straight away to the community pharmacist, and you can get your supply of medications for seven conditions. And we're going to talk to our special guest today about this. Today, our guest on the show, we would welcome Farooq Ghani, Mr. Farooq Ghani, Superintendent Pharmacy Manager, Primary Care Network Lead, and Community Pharmacy Northeast London Committee member, to tell us more about this service and also to answer some of our questions that our listeners have already put in. So we welcome you, Mr. Farooq Ghani. Thank you for coming to our show and giving time to us today.
Thank you. Thank you, Dr. Kamila. Uh, First of all, good afternoon to all your listeners. I'm privileged to be able to represent community pharmacy and speak about the new service that's been launched by NHS England.
Thank you, and we're very keen to know about this service as well because it sounds like I have read about this all this program, and I feel that it will be a very good entry to our healthcare system. So let's see what it is. Basically, I will start asking you, Farouk, that what is a community pharmacist and what services do they provide? So let's our listeners have some knowledge about the community pharmacist first before we roll over to other questions.
Thank you. That's a very good question, Dr. Kamila. Pharmacists, as are qualified healthcare professionals, we offer a range of advice, of clinical advice, and help manage patients' medication therapy. We dispense prescriptions and we give advice on treatment for everyday health conditions. Put it in a nutshell.
Okay, that's really good to know. So, can you tell us about the conditions that the pharmacists are now able to treat? And this is all about the campaign that is going on. So, what are those seven conditions that we're talking about?
So, along with all the services that we provide and the conditions we treat and give advice, NHS England has launched a new service called Pharmacy First Service on the 31st of January this year, 2024.
Okay.
The Pharmacy First Service, it allows patient access, consultation from a pharmacist, and receive treatment for seven common conditions. These conditions are mainly sinusitis for adults and children over 12 years of age,
Mm-hmm.
sore throat for adults and children over 5 years of age,
Mm-hmm.
acute otitis media, otherwise earache or ear infection for children 1 to 17 years of age, infected insect bite for adult and children over 1 year of age, impetigo for adult and children 1 year of age and over, shingles for adult age 18 years and over, and uncomplicated urinary tract infection for women aged 16 to 64 years of age. Those are the seven conditions that we are allowed to treat under this new service.
That's amazing. I think, you know what, for these simple things, people used to line up with the GP. There were no appointments available, and they had to wait for days and days just to get these simple things right and out of their way. So I think it will be a good thing. And because simple things like sore throat, sinusitis, earaches, any infection, if you don't treat it on time, obviously it grows and it becomes a bigger problem. So if you guys are able to nip in the bud at a proper time, I think we can actually, not only we can save time and energy, we can save patients to get into severe problems. So that's a very good service, I think, and thank you for all the pharmacists who have stepped in into this service. So obviously we do understand why this has happened, but we want to know from the horse's mouth why these new services have been introduced into NHS.
As you very well pointed out, patient getting easy access and early treatment for this condition is beneficial to prevent further events, uh, adverse events. Pharmacists are very highly qualified healthcare professionals who are expert in medicine
Hmm.
and who can help manage these conditions. So we see pharmacies are open longer hours and weekends,
Yeah,
thus giving better access to
absolutely.
better access to patients so that they can receive these treatments within a timely manner. It will be quicker to see a pharmacist rather than trying to get a GP appointment. And you don't usually have to wait to see a pharmacist generally. In return, you'll see a reduced burden on the GPs as well as freeing up GP appointments for more severe and critical conditions. So those are the benefits for these. Obviously, the patient can access these very easily in a timely manner.
Well done. I think that will be very good. So, how many pharmacies across England are offering the new services? And I'm sure
O-
thousands of
o-
people are going to get benefited.
Over 90% of pharmacies have registered to provide the service. We're talking about approximately about 10,000 pharmacies
Oh, wow.
in the UK.
That's a very good number. Yeah, I mean, I just picked up something you said, that pharmacists are qualified to give this advice, and there is a misconception, like understanding in people, that the pharmacists are not qualified enough to give the clinical advice. And I would like you to respond to this kind of this attitude. What do you think about this?
Pharmacists are, as I've mentioned previously, pharmacists are very highly qualified.
Hmm.
Uh, as a pharmacist, we all have to complete a Master's of Pharmacy degree, which is approved by the General Pharmaceutical Council at university. And subsequently, we have to undertake another years of foundation training, uh, depending on which sector you go into. If you're a community pharmacist, then usually in the community. And after the completion of the foundation training year, we need to sit a GPHC registration examination. So as you can see, it's an extensive learning and training period that we go through to acquire all the skills and
Absolutely.
knowledge to
Yeah.
to be able to provide clinical healthcare advice to our patient, manage their medical conditions, help them with the medication, as well as provide general health advice and well-being to our patients.
Hmm. And are you also registered to a professional body where you have fitness to practice framework?
Yes, we are. As I mentioned earlier, we are registered with the General Pharmaceutical Council, which is our
Yeah,
governing body. It's like the BMA or GMC
GMC, yeah.
equivalent.
And what is it called? Equivalent to GMC, what is that called?
General Pharmaceutical Council,
Okay, okay. So you are
GPHC.
you're reportable to them if there is a problem. So you can see that pharmacists have got the same networks, the same way that they follow their professional alliances, and their professional bodies are there to check their fitness to practices framework. So they are totally safe to give the clinical advice in their remit, in their professional categories. So I do think that this will open up a very good window for all the patients to not so they don't have to queue to the GP services, to the GP practices, and they can actually go to the pharmacies. As Mr. Farouk said very rightly, that the pharmacies are open for longer hours and there are more pharmacists available, and therefore the appointments can roll over much more quicker than the GP practices. So, just to give a background, that before we came for this show today, we had sent some questionnaires around and some question and answers for people to ask if they want to ask any specific questions regarding these services. So, we do have some questions here, and I've got them here in front of me. So, I'm going to ask Mr. Farouk about these questions. Are you ready, Farouk, to answer those questions? Yeah,
Yes, yes,
we're going to put you on
thank you.
that hot seat now. Okay, so one of our listeners had asked a question. His name is Arnav, and he has asked, "Can I go directly to NHS community pharmacist without a GP referral?" And he also asked, "Is an appointment required?"
No, absolutely. Anyone can access the service from walk-in service. That's what we call. You can walk into a pharmacy and present your conditions, and within a timely manner, pharmacist will be able to see you. You, depending on how busy the pharmacist is, it's usually quite uh, not a long wait. But generally, yes, yeah, they can access the service by walking into a pharmacy.
Okay, that's pretty good to know. And one important question that we all have to make sure that we adhere to as healthcare clinicians about the confidentiality of the patient's information that you have. So, can you ensure that that any health concerns that come to you are private and confidential?
Yes, as I mentioned, we are governed by the General Pharmaceutical Council. We have to abide by all the GDPR regulations, as well as all consultation are conducted in a consultation room. All pharmacies are equipped with a consultation room, so everything is private and confidential.
Good, good. Another listener, his name is Nupur, asks that my child has earache. How do I know that my child has an ear infection? So I think the confusion here is that they don't really know what the child is going through, so they go to GP or they come to a pharmacist. What is the line of action here?
Well, the ear infection or earache is mentioned is acute otitis media, and the most acute acute otitis media mainly affects children and usually lasts for about a week.
Hmm.
Generally, over 80% of these children recover without any intervention of antibiotics or any treatment. The common symptoms that you can experience is pain, occasionally some discharge, itchiness, irritation. Sometimes you can feel pressure inside the ear. And small children may be pulling their ears or rubbing their ear to indicate that they've got pain. As I mentioned, majority of us will recover with general analgesic, paracetamol. But when someone presents now with this system, we are able to do otoscopic examination. So look into patient's ears. So we can actually examine the ear to see if there's any changes or any discharge or discoloration or any cloudy uh, cloudiness in the tympanic membrane. So just to see if there is a underlying infection or any underlying other issues. So
Hmm.
we look out for bulging of the tympanic membrane, look at the land break if there is any air fluid levels. So we can look at that, or we can even examine if there is any perforation in the eardrum.
Yeah. Okay.
Those are the things we can do at the moment with the service. And as I mentioned, we can offer self-care advice. Generally, it's self-limiting and with analgesics. However, if the symptom is very severe, there is, depending on that, we can actually issue certain medication which they can obtain from us without going to the GP. We always recommend people to, if they're very unwell or if they suddenly become unwell, they need to seek further advice, in which case they can go to GP if the treatment hasn't helped within a few days. If there's any rapid onset, or worsening of symptoms.
Okay. Thank you. So I think that was a very extensive and a detailed answer. Thank you for that. So the next question that one of the listeners, his name is Avjeet, he wants to know a little bit about insect bites. So can you please let us know how a pharmacist can approach that?
Yeah, I mean, firstly, obviously, when the patient presents themselves, we usually do a certain history checking, who is it for, how long they've had the problem for, and so on. Insect bite and stings are usually not very serious, so that's the first thing to reassure your listener. And generally, insect bite will get better within a few hours or a few days, and generally do not need any treatment. And self care usually is the appropriate method of treatment of insect bite.
Hmm.
Usually antihistamines, steroid, topical creams, and analgesics such as paracetamol.
Hmm.
The common symptoms that you look out for in an insect bite or sting is, the redness and the swelling around the bite area. The skin feels hot when you're touching it. It might be itching and painful. If the insect bite and these symptoms last for more than 48 hours, then and the symptoms are, the swollen symptoms are there, then we need to further examine whether there is a possibility of infection. We look out for if there's any pustular discharge, and then we counsel the patient appropriately. Uh, and if necessary, obviously, we would do referrals. For example, if you suspect anaphylaxis or numbness or tingling,
Hmm.
then we would need to refer them to GP or other appropriate uh, providers. Uh, Patient who are pregnant would usually get referred. So there is, safety net where we actually will, where it's outside of our competencies, we will refer them onto the general practitioners or other um, appropriate healthcare providers. Um, and in some instances, if these conditions are not being treated within by self care, then we would in some instances we might consider other treatments such as antibiotics, depending on the appropriateness.
Absolutely. Thank you. And I think that was quite good. Um, So there's another very common problem that prevails, especially in females, and that's urinary tract infections. And patients want to go to GP. Obviously, sometimes GPs can't take the appointment so quickly, and it's a very painful and a condition where you can't wait for very long. But to be honest, the treatment is very simple. Once they are at the doctors and they get the simple treatment for uncomplicated urinary tract infections, they can be treated within 24 hours. So I think this will be quite good for the pharmacist to step in and take care of that. So Arshad is one of the listeners who have asked the questions that what are the symptoms of urinary tract infections, and will you tell me when I need to see a GP? At what point that they need to see a GP?
Yeah, absolutely. That's a very good question. And complicated urinary tract infection is very common, and we do see quite a number of these cases. And as I mentioned earlier, the accessibility and the
Hmm.
early treatment is quite important. So being on the high street within the community, patient can easily access uh, this service from the pharmacy. The main common symptoms for urinary tract infection is usually when you burning or when you're passing urine, uh, and you're waking up in the night to pass urine as well as the frequency of passing urine is increased, and occasionally you will be able to see cloudiness in your urine by the naked eye. These are the common signs of urinary tract infection. These are generally treated quite simply by analgesics if for the pain and a lot of fluid intake and rest. this is probably the first port of call. If these don't work, then and if the symptoms are not, if symptoms are mild and not thrush-like, then the possible treatment of what GPs will offer certain antibiotics that can, long as the patient passes the gateway criteria, we are able to provide that. Uh, Again, if symptoms worsen and there's a significant worsening within a time, then we do tell patient to go back to the GP or go to other healthcare providers. So certain symptoms, like if you're shaking and chilling and you've got high temperature over 37.9, your nausea or vomiting, kidney pain or tenderness in the back, then we will refer those patients immediately to either primary general practitioners or other providers who can assist them, which is outside our remits. But within our remit, we can certainly provide a lot of advice, clinical advice, and general
Mm-hmm.
self-care advice, as well as medication to help with the urinary tract infection.
Yeah, thank you for that. And the other thing is that basically I'm in psychiatry, but I do see problems like that in patients. There are some over-the-counter medications as well now that are available. That's quite good for urinary tract infections. Like there are sachets and cranberry
Yes.
tablets, and which I think people are not aware that they can actually buy, and they can get, like, at least they can get soothing from the symptoms that are appearing, and then they can buy some time going to the pharmacist or the GP or A&E, wherever they are referred to. So I think this was something very good that that the pharmacists will be able to do now. So, Mr. Farouk, I would like you to tell our listeners that. Where do we find more about, where are these pharmacists in their community? For example, I want to seek a pharmacist advice, but I don't know where to go, and I wouldn't be going shopping around from one pharmacy to the other. So, is there any app or any link or anything where they can find this information?
Yes, the link to find these pharmacies and the services is nhs.uk /think pharmacy first. So that's nhs.uk /think pharmacy first, all one word.
Okay, and in that, if you put your, I imagine if you put your postcode, then you'll be able to get the pharmacy. And is that upgraded every now and then? Because if there's a service that is closed or something, um, we don't want to go there all
Yes,
the way, spending 15 minutes to go there, and then we say the pharmacy is closed now or the pharmacists are not available anymore.
no, those information are available readily on that and is updated regularly. Yes,
Okay, so that's good. So again, I would repeat, I think it's nhs.uk/think pharmacy first. Is that right?
think pharmacy first.